Hey everyone, I am Shannon and I am the owner of Resilience Physiotherapy. And today we wanted to do a live with our newest hire, Dr. Brian Wright.
Hi everyone.
He is our chiropractor, and today's Instagram live is mainly to talk about the differences between like a manual physiotherapist and a chiropractor, some of the things we both love to treat, some differences that we have, and how you can use us kind of in collaboration, and how we can both help you on your journey to getting you back to all the things that you love to do. That's because that's our mantra at Resilience Physiotherapy. So why don't we start with like a little introduction? Dr. Brian, we posted a little introduction the other day, but why don't you talk to everybody about what you enjoy treating the most, and some of the tools in your tool belt.
Cool. Yeah. So hi everyone. If I haven't met you yet, I'm Dr. Brian Wright. I'm a chiropractor and I've been working in Toronto for about 8 years now. I'm in my 8th year. I'm a graduate of CMCC, the Canadian Memorial Chiropractic College up in North York. I'm really excited to be working here at Resilience now. So the type of person that I want to work with, I mean, I'm definitely open to working with anyone, but some people that I really like to work with are people who are getting back into exercising or exercise regularly. Maybe someone who is getting back to the gym and is noticing that their body's not moving as well as they'd like it to. And I have a particular interest in working with people with headaches. So things going on with the head and neck. There's a lot of different types of headaches, a lot of which can be helped with chiropractic and physiotherapy care. Yeah.
That's amazing. And then you had also mentioned another thing is the jaw.
Yeah, for sure. So I do work with a lot of people with jaw pain. So there's different manual therapies that can be done to the jaw itself. I also am trained in acupuncture, so functional acupuncture, also called medical acupuncture. So basically, acu to the jaw itself, the needles go directly into the little muscles that make up the jaw. And this brings, extra blood flow to the area. It keeps the muscles moving as well as they can. It's actually really effective for treating jaw pain. I also do internal work to the jaw. So basically, while gloved, you go into the mouth and do little almost massage techniques to the muscles that make up the internal part of the jaw.
Which is awesome.
Yeah, it's pretty cool.
I gotta say, the jaw is not my favorite thing to treat. So I'm really, really glad that we have somebody on board that's your jam. That's really awesome. So that's a couple of things that Dr. Brian likes to treat. Like any of our practitioners, he can treat obviously any aches and pains that are in your body, but it's important to kind of know, or I like to position each clinician or ask each clinician that works here, what's your jam? What's your favorite things to treat? Because, then you'll be very successful. So a little bit about me and some of the other physios that work here. So most of us are manual physiotherapists, either in training, like doing some of the levels or different coursework, or myself, I'm what's called an F-camped. So it's interesting. This is where the lines between physio and chiro get a little bit blurred. So when we graduate from physio, we're kind of jack of all trades, master of none. And then there's 3 different areas of physio that we train in: cardiorespiratory, neuro, ortho. Ortho is the lane that I chose. And then you tend to do tons of coursework and mentorship and kind of progress your skills from there. So as a F-camped, basically, I have learned most of the manipulations that you would have learned for your basic degree program, for your doctorate. So that's where manual physiotherapy and chiro, the lines they're a little bit more gray.
Yeah.
So that's why when there was a chiro that used to work in the same suite as us, and when she retired recently, it just seemed like such a beautiful thing to bring a chiro onto our team at Resilience, because I would cross-refer to Dr. Eva Chan, who used to work in here all the time. And so when I was hiring someone, it was really important to me to find a chiropractor with the philosophy of doing more than just manipulation. So Dr. Brian can probably attest, I grilled him in his interview on his clinical reasoning, because to me, that's so abundantly important. I want to, anybody that I'm bringing onto the team, I want to get an idea of how they practice, like their thought process, how they come about diagnoses, like what their plan of care looks like. And you blew me away. So yeah, I am quite confident. He very much considers joint, nervous system, muscles, like you, and it sounds like, especially with all the different tools in your tool belt, you would treat kind of a variety of things within a session.
Yeah. And honestly, that is something that really attracted me to working at Resilience as well, is kind of a central focus on the spine and nervous system, and how those things can actually affect things down the chain, which kind of I would have originally thought is a chiropractic sort of mantra, but I'm really happy that Resilience has taken on this mantra as well, and it's a good mesh for sure.
Well, I think that's a really valid point. So I think from the word go, as chiros, you consider the spine and the nervous system and how it's affecting everything down the chain. I feel like that's a big part, correct me if I'm wrong, of the methodology of chiropractic.
Definitely. Yeah.
Yeah, totally. Yeah. And there's all kinds of different physios out there, and we all practice differently. But the longer that I was in practice, and I had some really awesome mentors along the way that really expanded my clinical reasoning. And really at the end of the day, that's why that is our mantra here at Resilience, that most of the time when you have that ankle sprain or that knee that's a bit messed up, unless it's like a really traumatic thing where you've literally like tripped and fell on ice, or you're at a trampoline park with your kid and you like broke your ankle, rolled your ankle.
Yeah.
Most of the time, those things that are happening in the periphery are because of potentially other things that are going on up the chain, nerves that aren't firing properly, which in turn, then there's certain imbalance and weakness on different sides and patterning and stuff like that. So anyways, so that's great. So I think that's like a lot of our similarities.
Yeah, no, I think it's great.
So maybe let's talk a little bit about, so here at Resilience, the whole idea with anybody that you go to see here is collaborative care. So we all share patient charts. We all have access to what everybody else is doing. And prior to Dr. Brian coming on, I've had patients remark they're so thrilled that if they can't get in with a certain clinician, they're more than welcome to see somebody else. And they feel like they get that consistent care because of the fact that, we're constantly in collaboration with each other. We're chatting with each other to make sure that the treatment plan is, as similar as it can be. Every clinician that you see, physio or chiro, is going to treat like a little bit differently because none of us are like cookie cutters of one another. But so I see chiro as just like an extension of that. Like Dr. Brian is literally going to just be another clinician in this clinic that you can go see. He will have access to your chart. Why don't you talk through like a treatment with you and how it might look a little bit different than with a physio?
Sure. Yeah. So a treatment with me can look a bit different each time. So I'm always going to start with a thorough assessment, see how all the joints are moving, see which muscles might be tighter or looser compared to last time. Visually, it's a big functional assessment to see what you need that day, and not just where the pain is, but how things are actually functioning. So treatment would often include some manual adjustments. That's one tool in my tool belt, but also do a lot of soft tissue work and sort of retraining of different muscles. So when I say retraining, it's basically a mix of education and then teaching of different exercises to kind of help things along, because I can only do so much in one visit, right? But I want to have people working on things at home as well to help them along the way.
Okay. Yeah. Awesome. Yeah, so that's very similar to, again, how the physios here would treat as well. We were talking kind of a bit before we jumped on here about maybe when you would book in with a chiro versus a physio. And a couple of things that we kind of landed on. I feel like for really acute neck stuff, I feel personally like Dr. Brian is probably your best bet for like point of entry. I personally love to treat the spine. I love to treat like neck, thorax, lumbar stuff. But I feel like my zone of genius is not really truly acute neck issues. So we were talking about how, like, if you were a migraine sufferer or the TMJ stuff, acute neck, spine, rib stuff, Dr. Brian would probably be your best point of entry into our clinic. And or kind of for like more stubborn things that just haven't.
That would make sense. Maybe like a really stubborn joint that you're thinking, wow, this is not responding how I thought it might.
Yep.
I might be able to at least look at it in a different way. Not a better way, but just a different way.
Totally.
Yeah, it's another tool
in
the tool belt.
That's the benefit of collaborative care. And I think the reason I wanted to do this is I feel like sometimes the chiro industry has a bit of like a PR problem. Like some people seem very afraid of chiros and they don't need to be. All of the manipulations, if they choose to do them, are no different than if I chose to do a manipulation. You're screening. We're constantly doing an assessment. We're not just having somebody lie down on our table and go, okay, like, let's get her done. Like we're screening for red flags. We're looking for things like osteoporosis, things that would maybe make a manipulation contraindicated. But also, like, at the end of the day, the patient always has the authority to say yes or no and to give consent. And again, Absolutely. Manipulation is one tool in like both of our tool belts. And it's not the only thing that we do. The manipulations that Dr. Brian will do, we're in the process of getting in what's called a drop table, for Dr. Brian. So it actually might look a little bit different than maybe some of the manipulations that I would do, because I don't use segments on a table to do certain things like that.
And basically what a drop table does, it is allows us to apply a bit more pressure to a joint without kind of a big impact or force being put through the spine itself. So it's basically to ease an adjustment to make it more comfortable for the patient. So a lot of these things can actually be done without a drop table, but a drop table makes it much more comfortable, especially with work that requires a bit more force to manipulate, like the pelvis. These are big, strong joints that take a bit more to move around, right, compared to other parts of the spine.
Right, and again, not having to place the body in as much perhaps like rotation and different things, keeping it quite safe. So, so chiros are our friends. It is the messaging that I want to give. I never would have brought a chiropractor on to Resilience if I didn't strongly believe in chiropractic care. I've worked with incredible chiros over my lifespan at various different clinics. And I think, we work beautifully, like, hand in hand together. And like and also like in our economy right now with, it's not as great as it could be. And some people have like limited pools of benefits. So like that's another thing where that's not the primary thing that I want to position, but it is like, it's a thought. It's like, it's a way that we can kind of also like extend your care. Like if you are covered under insurance, most people would have like a pool for physio and a pool for chiro.
Exactly.
And it's something that's also like a consideration.
And I think and speaking on that as well, I think it's really important for people to build a team of people that they trust rather than just one person, because it's many different types of ways of looking at a problem that can often be the way that you fix it. Whether it's looking at a physio, a chiropractor, an osteopath, a massage therapist, if you can find a team of people that you trust, that you believe in their work and they do good work, these kind of meshing together of different knowledges is really what is going to help people in the end, I think.
Yeah, like there's no I in team.
Yeah, exactly.
Yeah, no, totally. The other thing that I was going to mention that I forgot earlier, kind of in regards to, and you had kind of put it beautifully, like if you're in the phase of your journey that's maybe a bit more like say like that longer term rehabilitation,
right?
That might be more appropriate for like a physio referral, if that's.
Yeah, I've been referring to physiotherapists since the start of my career. Someone comes to me, although I've not worked in a clinic with a physio, I've had to do out referrals. But if someone comes to me, say with a very acute sprained ankle, and there's a lot less that I'm going to be able to do for that when it comes to a physiotherapist that will kind of be able to, reteach them how to walk and strengthen certain muscle groups. Where if they come to me with a different sort of acute problem, like a really inflamed low back or neck, that maybe a kink in the neck that they woke up and they can't move their neck, that is a lot more within my wheelhouse than something that's going to require a lot more physical rehab.
And that's also kind of showing like the journey of care even, and that's the beauty of having different disciplines under one roof at a clinic, right? So
exactly,
you saw Dr. Brian for that acute neck that you woke up with, and then he got you moving and kind of out of that acute pain, but it's still not moving exactly how we want. There's neck stability that needs to be built. That's where you might then, after like a certain number of sessions, then refer to physio.
Right.
And then also like within our kind of umbrella of offerings, we also have clinical Pilates physiotherapy as well. So like if you're looking at your kind of your acute versus your subacute versus like your long term, then that's when we both might then refer you on to one of our clinical Pilates physios to kind of say, okay, you're actually doing really well and you're out of that like acute like pain process. You're not getting that feedback, but you know what? You've got some work to do if we want to be kind of 100% and like foolproof that this isn't going to happen again. So then working through like the strength bit and that is really important.
Yeah, no, I think that's awesome. Another tool in the tool belt can retrain different muscle groups, keep everything strong, and not only just, I would say it helps preventing plateauing as well.
Yeah, absolutely.
Like it can get people to that next level that they want to get to.
So a common myth that I think the general public might think about when they think of chiro is, well, I'm going to have to come and see you like every week for the rest of my life.
Right.
So I think it's important. Well, what are your thoughts on that first of all?
Well, let me myth bust that a little bit. It's like there's nothing that chiropractors do to the spine that would make you need to keep coming. You know, we are treating things as we see them, making things better. You should be feeling better when you leave. I think you get a lot of kind of immediate relief with chiropractic care, which is something that people are often happy with. But it's a normal part of the process first to work on the spine. For things to feel a little bit better immediately after treatment, and things to shift a little bit back in the days following treatment, which is why we don't often just see someone once.
I mean, I think that's most practitioners.
But certainly nothing that would say that you need to keep coming. I think a lot of people enjoy the care they're getting, and in some regard come back. But
no, that's fine. And certainly like this is nobody, just by the way, if any practitioner touts themselves as like a one and done scenario, like just run direction.
Agreed.
No, like rehab of any type, of any journey is a process. So like your practitioner is going to sit down with you on day one and talk about like a plan of care and what they think is realistic for like a timeline and how many visits per week, that kind of thing. And that's going to be unique to the practitioner and your problem, right? Because like nobody's cookie cutter and nobody is,
and different types of problems require different treatment lengths as well, right? So,
absolutely. But the point being is we're here to help launch you, get you more independent. We want to get you pain free. We want to correct imbalances so that the whole point is that you don't need us long term, because we want to help other people. We want to get them in the schedule. So both of our methodologies is more about like, let's see it through. Let's get you back to all the things that you want to do. And then you're off. And, you can always come back and check in with us. But again, I think that's actually a pretty common myth and perhaps an older school of thought of chiropractic as well.
I think so. I know the School of Physiotherapy has developed a ton in the last 20 years as well, but chiropractic has taken many leaps and bounds of change in the last 20 years.
Yeah.
Where I think now we're seeing most graduates coming out of, especially the Canadian Memorial Chiropractic College, training in Canada, are coming out with, a very thorough knowledge of the body, but also looking at things from a very full body perspective rather than, just the spine itself, looking at things as a whole. I think it's really important, and it's leading to much better care.
Yeah, which is awesome. So I think we kind of covered the majority of the things we wanted to talk about today, not drag these people on forever and ever. But yeah, thank you so much for joining us. If you have any questions for Dr. Brian, or myself, or quite frankly, anybody on the team, we all offer 10-minute complimentary calls. So you can actually book into our schedule and have a quick phone chat with us to see if we would be a good fit for you. But also if you had more questions about chiropractic and care in general, or how we work together.
Honestly, yeah, I'd be happy to answer questions. I'm now up on our Jane booking site. So you can find me just as you'd find one of the other practitioners here. So you can book online with me.
Awesome. Okay. Thanks.
All right. Nice to meet you. Bye.
Bye.